Hey guys, my name's Alyssa with 3D PT, and today we're going to go through a couple of exercises and what to do, what not to do immediately following some knee surgeries, including a total knee replacement, meniscectomy, arthroscopy, ACL reconstruction. These are things that you can do, like you should be doing right away at home before you start your rehab. So the few things that I wanted to talk about are going to be pain, motion, swelling, and starting to get a little bit of strength back in the muscles surrounding the knee joint. So the one big thing to focus on is going to be icing and elevating your knee. So when you do that, you should do a couple times a day, and you want to make sure your leg is higher than the level of your heart doing that, so that the blood can really kind of flow back through the lymphatic system. So multiple times a day, icing and elevating. The first exercise we're going to go through is something called heel slides. So that's going to help you start to get the motion. It's okay and safe to bend your knee after surgery. So something that you can do at home is if you have a stretch strap, that's great. If not, you can always use something like a dog leash or a long towel. And laying down, you can take something. In here, we'll use a pillowcase, but at home, you can always use like a little plastic bag. You're going to put it around your foot just so that your foot slides nice and easy on whatever surface. Put this strap on around your foot, and then laying down here, you're just going to use your arms to pull on that strap and bend the knee as far as you feel like you can. Hold it there for a couple of seconds and let it back down. Usually I would recommend doing these a number of times per day, like maybe 5 times a day, and you can always do like 10 or so repetitions. But just trying to get more motion in the knee joint. After those ones, then you can start working on the strengthening and muscle activation. So I like to do something called a short arc quad to start. So you can put something underneath your knee, just like this. And then what you're going to do is try to squeeze this muscle here, push your knee down, and lift your heel off the surface. So you're just pushing down and lifting up. Just trying to get a nice muscle squeeze right here. That can be pretty tricky immediately following a surgery. So these are also good to do like a number of times throughout the day. Another good strengthening exercise that you can start to do right away is something called straight leg raises. So again, laying down, usually I'll have you bend your non-operative leg. You want to squeeze that muscle again and lift your leg straight up just to about the height of the other knee, and then back down and relax. So you're going to squeeze, lift, lower, and relax. All right, so doing that one a couple of times a day, maybe about 10 repetitions, as many as you feel like you can do before that muscle gets really tired. And then we can talk about another thing that's really important. So we worked on the bending, we worked on the muscle here. You also want to work on getting your knee all the way straight after surgery. So what I'll have you do is come down to a chair. You could take maybe your kitchen chair, desk chair, whatever works, and then put another chair, something in front of it. Maybe it's your couch, and you want there to be space under your knee, but you want that chair to be underneath your calf. And then what you can do is just either let it hang there so you get a little stretch in the back, but you want to feel the pressure kind of below the knee, not a pinching in the front. If that feels good there, you can always give maybe just a little bit of pressure, or you can squeeze that muscle again to try to get that quad activation. So again, I would do this a couple of times per day, just really trying to work on the straightening. Last thing you can do just to prevent blood clots, this is always a good one, just some ankle pumps. So whether you're sitting on your recliner, sitting in bed, sitting at a table, you should always be moving that calf just to kind of prevent any blood from clotting. And otherwise, those are your key things to do right after surgery when you're still at home before you start your rehab. So do those couple things, and good luck.